In this video, I'm going to show you the miracle cure for frozen shoulder, whose medical term is called adhesive capsulitis, as well as some supportive stretches and exercises. In my practice, this condition is almost always found in women over 50. In fact, a Korean patient of mine once told me that in Korea, it's called the 50-year-old woman's shoulder. There's really no clear reason for it. It generally creeps up slowly, and women generally notice that they have difficulty clasping their bra behind their back. The diagnosis of frozen shoulder is pretty straightforward. It's the inability to lift the shoulder either assisted or unassisted. So when I'm making the diagnosis, I'll lift the arm up, and I'm really hoping I can lift it up passively all the way. But even with frozen shoulder, even passively, you can't lift it up. And so the miracle cure for frozen shoulder is acupuncture, which obviously you can't perform on your own. The culprit can be any of the rotator cuff muscles, but I find that it's mainly the subscapularis, which is the muscle under the scapula or the wing bone. And in my private practice before I became an acupuncturist, I used to do massage in the sideline position, but it's really hard to get into that muscle. Maybe I could only affect it 10%. But the best results are with the patient lying face down. I get a 5-inch needle and I slide it right up underneath that scapula. I'll put 2 or 3 in, and it really helps to release that muscle. But even after the acupuncture treatment, you still have your homework to do in the form of stretches and exercises to complete the therapy and keep that shoulder opened up and moving smoothly. For these stretches and exercises, you're going to need a weight. I have a can of tomatoes. You're going to need a resistance band, and then you're going to need a belt, something stiff. I'm going to be using a dog leash. So the first stretch to open up the shoulder is the pendulum stretch. You want to bring your body to 90 degrees, support yourself with your hand, bring the affected shoulder down, and just do kind of rotation or back and forth. And this is creating traction to open up the shoulder. If you feel comfortable, you can even do a heavier weight. This is a 1-pound weight. And when you're doing the pendulum, you don't want to really use the arm to do it. You want the arm relaxed, and just use your body and swing back and forth or around in circles. And just enjoy this traction and try to open up the shoulder and try to make the circles wider and wider. And then if it's the other hand, obviously, just switch arms and come like this, using your body for that momentum. And you'll want to start swinging it further and further as your shoulder opens up. The next stretch is what I call wall crawls. So with adhesive capsulitis or frozen shoulder, it's really hard to do motions like this or motions like this. So you'll want to go up against a wall and slowly use your fingers to crawl up the wall, and then just continue as far as you can. And these exercises are not fun. If the shoulder is really inflamed, it's going to be painful. You just have to push through it. And then you can turn around and go up the front area, wherever your lack of range of motion is. Now remember how I said women first notice it because they have a hard time clasping the bra? So this is where the dog leash or the belt comes in handy. Just drop it over the shoulder, bring the hand back, and again, if the hand can only go this far, you'll want to drop it really down low, grab onto it, and just use this as a pulley to pull up as far as you can, and continue to stretch and challenge the range of motion. You can bring it even out to the side and then pull the arm in this direction, just opening up that shoulder. And then finally, the last two you're going to be doing sitting. And then one is just gentle retraction of the shoulder. Up, back, down. Up, back, down. Just trying to get movement and fluidity in those shoulders. And do both shoulders as well. Because I'm sure once you can't really use one that well, the other arm can kind of burn out because you're overusing it to compensate. And so you don't want frozen shoulder on two shoulders. And then finally, an exercise. Once the shoulder starts loosening up a little more, this could be done seated on a chair or seated on the table. And then they're just rows, bringing the shoulders back and forward, back and forward. Just doing this for about 1 minute. You can continue to use the leash like you did with the wall crawls. So here I'm bringing the arm in front of me. The same as when I was crawling up the wall, but if you feel it's more comfortable with the belt or a leash, you could use it this way, or bring it up to the side as far as you can, or even across and in front of the body. And with this one, you can actually just use your arm to do this and just give it a little push. Another way to stretch the shoulder, and this one might be a little more comfortable because it's more passive, is to sit at the edge of your chair and then find a table or a countertop and then put the arms here. This may be as far as you can go. And then you can slide back, drop down more, slide back, and then drop down more. And you're just using gravity and you're relaxing into this and making sure you're breathing. And then you can rotate the arms like this and go through the same movements, dropping down and dropping down as far as you can go. You may only be able to go to here, and that's fine. So this next stretch is similar to that table stretch, and it's the child's pose in yoga. So I'm just going to be sitting on my heels, reaching forward, open up the legs a little bit, reach forward and stretch out. Now this may be as far as you can go, and that's fine, but keep trying to push it. Keep crawling forward with your arms, and then maybe you can even bring yourself all the way down. You can then stretch the affected arm like this on the side. Again, stretching different muscles. And then down. And then of course we can't forget the Theracane and self-massage. That's going to give a lot of relief with frozen shoulder. Oftentimes my patients, even though the problem is in the back, they'll feel some pain right here in that bicipital area. So just for palliative relaxation care, just come in here and work into this muscle. But the main areas are going to be back in here, up under the armpit. And you can just work in with the Theracane, bring the arm on a chair, and just get in underneath and work that muscle. Massage it back and forth. Even sometimes it can kind of creep up into the neck area as well. As the area starts to compensate, other muscles have to work. And you could just continue around and just find the areas that are sensitive and just work in there with some massage. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. And I'll be available for any questions you have or suggestions for future videos.